Very interesting knowledge sharing contents. The correlation of neuroanatomy and acupuncture. From the perspective of neuroscience, we may regard acupoints as both signal receptors and effector apparatus. So we need to find out, is there any special structure at acupuncture points compared to the non-acupuncture points? Is there any tissue cell response at the special acupuncture points? What are the components which are stimulated after the needling process? What structure mediates the afferent and different signals of the acupuncture to induce the desired biological effect? There are many questions like this, where by this long study of different evidence-based data which we compiled from various sources from many months, will share in this audio series. In a pioneer studies which was partially published somewhere in China in Chinese about a year 1959 and 1973 in the Department of Anatomy, Shanghai First Medical College, 1973. So in this study, they observed carefully about acupuncture points of 8 adult cadavers and 49 dissociated upper limbs and 24 lower limbs. They used nano anatomical approach to find out what is happening with this. To retain the cadaver intact and under similar conditions to that of living, they used a combination of liquids like an antiseptic fixation liquid which composed of formalin 10%, carbolic acid 5%, 95% alcohol, glycerin around 10% and water base. So in this, a renowned TCM expert or acupuncturist Dr. Ding Li was called upon to do this particular experiment. So they have chosen a common acupuncture needles. All acupuncture needles which are commonly used based on the traditional Chinese medicine literatures, the metal milli needles were inserted into the acupuncture points and transverse dissections were subsequently performed. So the distribution of nerve around the needle about 0.5 centimeter was carefully examined. So they chose around 21 acupuncture points, mainly PC6, TE17, GV15, TE21, GB2, SI5, TE4, LI5, LI4, ST36, LE7, LU6, LU10, LU1, LU5, LU9, CV6, CV8, CV22, SP6 and CV2. And each of these acupuncture point, the needles were used for histopathological studies. Tissues were observed by HE staining, Mallory staining, elastic fiber staining and reticular fiber staining. And end of these nerves were observed by Kajal method and the BG methods. So the results of these were very interesting. You must and should, if you are very keen for going in deep about acupuncture, you should listen further from this. If you are not so much interested, you should drop at this point. So this study shows that the meridians and acupoints were very closely related to the distribution of peripheral nerves. See how interesting the study is. On one side, there is a traditional Chinese medical system trying to explain about acupoints, and on other side, neurophysiology trying to explain about how the acupuncture works or how this traditional Chinese medical systems works. So this combined study is a better example of an integration where neuroscience and TCM science were integrated both and did a study. So unbiased study was published, and it shows that there is a clear indication that distribution of peripheral nerves, there is a relation of meridians and acupuncture points. So this one must understand that there is a lot of rift between modern medical doctors, so-called conventional medical doctors, and alternative medical practitioners, or in India we call it as Ayush doctors, Ayurveda, Yoga, Unani, Siddha, Homeopathy. So there is a lot of rift. One person's language of understanding of disease is not accepted by another person's language of understanding of disease and treatment of the disease. So there is very difficult transaction is that to connect these two people and make them give an evidence based content based on what they are studying in their own language of understanding. Let it be Chinese medical system, let it be homeopathy, or let it be any other science. So this particular study shows a clear understanding of meridians, acupoints, and peripheral nerves. Although the acupoints are also related to skin, subcutaneous tissue, blood vessels, muscles, and connective tissues. So this correlation of peripheral nerves is very interesting to see how the neurophysiological changes happens with acupuncture. So when we do acupuncture in I am well integrated medical acupuncture therapies, we consider all these details, and before even we prick a single needle to any patient of us, so we go through much detailed specialist evaluation from concerned conventional medical doctors, and then only after approval of this doctor, then only we take up the patient. So stay tuned for further details. Now what I am trying to share with you is the location of acupoints in relation with the anatomical structure and the physiological changes happening along with that. So we got to know that there is a definite correlation of meridian points, acupoints, and peripheral nerve distributions. With this much of understanding, there was one more study conducted in 1958 where 324 acupoints of 12 meridians and conception vessels meridians were observed, and it is published in China in 1959, 1958, 1960, and 1973. So based on these 323 acupoints and its correlation of nerves, so this is very interesting, where the observation says that 99.69%, that means 323 acupoints out of 324 acupoints were examined, and they observed that there is a close relationship with nerves. See this wow factor, where even allopathy doctors, conventional medical doctors also should acknowledge and accept this research data what I am sharing. Very interesting. So amongst these 323, 304 acupoints were found in relation with superficial layer of cutaneous nerves, accounting for about 93.83% of total acupoints. And while other 170 acupoints were observed in relation to the deep nerves, accounting for about 52.50%. So it is further observed that around 149 acupoints were in relation with both the superficial and deep layer of nerves, accounting for about 45.99% of total acupoints. So just one thing you notice that we find a dense nerve distribution under each acupoint. Is that the wow factor for you or not? The upcoming details what I am going to give you is the name of acupoints, the cutaneous nerves related to that particular acupoint, and the deep layer of nerves related to the acupoints. So let us see, let us study together. I hope these particular informations are useful for mainly for students of naturopathy, BNYS, and other students who are interested in studying acupuncture and practicing acupuncture. So based on your curiosity and interest, you can dive deep, or you can just study superficially, as most of people will do and practice, which will be of not much help unless you study deep and show the result for the patients who come with lots of hope for you. So let us stay tuned for upcoming details of acupoints and its relation to superficial and deep nerves.